Are there things that jump out at you as someone that you need to say, okay, it's time for you now to go talk to Dr. Shields in consultation with me?
Yes. So some of the core indications for deep brain stimulation or focused ultrasound are generally when the medications are falling short. So in particular with the movement symptoms, because deep brain stimulation does not help the non-movement symptoms. It does not help speech or balance, necessarily cognition or swallowing. But if there's tremor, in particular tremor, but the medication, carbidopa, levodopa, when I mention medication, is not holding that tremor at bay. And there's a lot more tremor and or dyskinesia. That's an indication to consider DBS. And then we really want to think about how the medication's working for that patient. If the medicine has a distinct good response, carbidopa, levodopa, but wears off early, so we see a positive medication response. On the other hand, we know that if the carbidopa, levodopa kicks in and has a wishy-washy response, DBS will have a wishy-washy result. So we want a distinctly positive response to carbidopa, levodopa, motor fluctuations and or dyskinesia. And we want to have good balance and intact cognition. And so, in part of the process of thinking about DBS, patients need to have, we do not, Dr. Shields does not perform brain surgery on someone who has significant psychiatric issue or dementia issue. And that surgery could make patients worse. And so we want to intervene on a window of time that makes sense. And that's when there are movement symptoms, fluctuations or dyskinesias, tremors. There's a good response to the medication, and we've got intact balance and cognition. So that's a window of time, maybe a few years perhaps, but I think that's a conversation we're always thinking about.